Good evening, students. Today we will discuss about another chapter of activity in occupation therapy. Our course code is OT 104. We will discuss about activity analyzation in today's class. Why we are doing activity analyzation in occupation therapy and how occupational therapy will get benefit when they are doing analyzation of client activities. So first of all, what is activity? Activity, anything, any movement where your mind and your body work together. It's called activity. For example, you're doing any task, playing, eating, cooking, taking shower, anything. Your mind and body work together. It's called activity. And what is activity analyze? Activity analyze mean to say someone is watching you while you are doing some kind of activity. Someone mean to say you are a therapist or your physician. These days, activity analyze include social, political, cultural evidence. They include everything in activity analyze. So activity analyze based on three pillars: task basis, theory focused, and individual focus. We have three pillars when we are doing activity analyzation: task focus, theory focused, individual focus. So let's explain this scenario with one example. There was a patient. She was diagnosed carpal tunnel syndrome. Carpal this one. And what happened in carpal tunnel syndrome? We have that median nerve here. So when our median nerve is suppressed or pressed by any reason, they start emitting severe pain and we can't grip properly. So that problem or that medical condition we call carpal tunnel syndrome. So the one lady is suffering from carpal tunnel syndrome. Now, one therapist is assigned her to treat her so that she can make their daily routine activity. So discussion start. She told therapist that I love to cook lasagna with garlic bread because all my family members, my husband, my children, they love to eat lasagna. And from there he understand task focused because client task was to make lasagna. And she explained that why everyone loved to eat lasagna, because the lasagna is coming from their grandmother time, because the recipe is a very old recipe which her grandmother was using. Now culturally connected, the task culturally connected, socially culturally connected. Second, now he asked more question. In second question, what are the recipe and how you are making lasagna, so that he can pinpoint actual reason why she can't making her task properly. So she explained the recipes. She explained utensils they're using to make lasagna. She explains the kitchen setup. So what therapist found, it's not only the recipe she was using which coming from her grandmother time, but also she was using the utensil which were from her grandmother time, antique utensils, and they were very heavy to hold. So from there he pinpoint, oh, that's why because you have that carpal tunnel syndrome, and in that case you are most of the time you have pain in your hand, you can't grip properly, and your utensil is very heavy. So what therapist did during activity analyzation, he understand or he pinpoint the main reason, or he found the main reason why she can't making their daily routine activity. So he changed the utensil size. He get the new utensils. They were very light, easy to hold, and she start making their family favorite dish, which were lasagna with garlic bread. So student, with this example, I think you understand why activity analyzation is very important as a therapist, so the therapist can understand the actual reasons why her or his client is not performing her daily routine activity. So this is all about students activity analyzation. So I think you understand the meaning of analyzation, activity analyzation, and why this is important in occupational therapy or during the intervention, which is most done by the occupational therapist. So thank you so much. Next lecture I will get new topic we will discuss. Till then, take care.